Teeth need rescuing? Then these tiny heroes might just save the day. Mini dental implants are the cutting edge technique that can make someone smile today, and that someone could be you. Here to share her decades of dental wisdom is Dr. Andrea Joy Smith. Hello, Dr. Smith.
Hi, Desiree. Thank you for having me today.
Yes, always a pleasure having you on. Dr. Smith, let's start with the basics. Why is it imperative to get routine checkups with your dentist?
Yes, routine checkups are imperative because some dental problems are asymptomatic. They don't have symptoms. For instance, periodontal disease. Patients could be losing bone around their teeth with no pain, and before you know it, they lose a tooth and they're in need of an implant.
And being that it's important to get those routine checkups, what do you think hinders people from fixing their teeth or going in?
Yeah, during the 30 years that I've been practicing, it's mostly fear. Patients really have a fear of going to the dentist because they have a fear of the pain, they have a fear of the cost sometimes, and it just kind of keeps them away. And some patients actually do their best to take care of their teeth as best they can. So that they don't have to visit the dentist. And usually, those patients have problems that they're not aware of and they're discovered for the first time. And it sort of kind of shocks them that they actually have problems. So it's the dental fear that keeps it away.
Yeah, is there a dental option out there that maybe addresses these concerns?
Yes, in my office, I provide sedation dentistry. That is where the patient is consciously sedated, which means that they are able to breathe on their own. However, they are relaxed enough to receive the treatment without fear. They normally feel as though they've fallen asleep, and all of a sudden they wake up, the work is done. They'll often get home and ask their companion whether or not they had the dental visit today, and normally they have. But the memory of the visit, the amnesia effect of that oral conscious sedation medication really makes them have a pleasant dental visit.
Yeah, and it helps relieve some of that stress that some patients might have. Well, we're trying to get a perfect smile, Dr. Smith, like you got on that screensaver over there. She has a really nice smile. We're trying to get one of those. Who would you say makes a good
Yes.
candidate for mini dental implants?
Right. Well, I'm glad you see her on the screen. She's actually one of my mini dental implant patients. Good candidates are patients that have been missing teeth for a while and they haven't had them restored for reasons, sometimes financial reasons. Conventional implantology proves to be a little bit more expensive than the dental implants that I provide in my office. And so getting regular routine visits as well as having dentures for a while. Patients that have had dentures for a while are also good candidates because they are usually tired of using the Fixodent and things of that nature. And because we use a smaller diameter one-piece implant, we can usually convert those patients to fixed restorations that don't come in and out, or at the very least, we can stabilize those dentures.
Okay, so walk us through the process on how mini dental implants are installed.
Yes, usually it's a one surgery technique. Most conventional implant procedures are two surgeries where the implant's placed and buried under the tissue, and then later an abutment or the item that's going to actually hold the crown or the denture in place is inserted a few months later. But with the one piece implant technique, we can actually place the implant that is already attached to the abutment, and so the denture can be stabilized in one day as well as the crown can be put on the same day as well.
Okay, so it looks like it's a routine that can be done fairly easy and quick. What's been the response from your clients when they get a mini dental implant?
My patients have been pretty shocked. They've heard a lot of stories about patients or people that they know who have gotten implants, and they've heard these long stories to say, oh, I got the implant today, but I won't get the tooth until there's a year away. And they're often surprised by not only the time that it takes to get a small diameter implant or a one piece implant, but also it's less painful, it's less invasive. We don't have to do any type of surgery. We call it a microsurgery
Hmm.
because we're not opening the gums to actually place the implant. We're not taking away any bone. We're just simply placing the implant through the tissue. So they respond very, very well because they're really shocked at how quick it is and how easy it is. And the fact that they walked in without a tooth or with loose dentures, they're walking out with stable dentures the same day.
Yeah, and I'm sure they're ready to show off that smile. Dr. Smith, always a pleasure having you on the show. I'm going to let our viewers know where they can go for more info. You can find out more by going to smileagainnow.com.